Hello everyone. We are continuing the talking about the exam domains. So one of the important exam domains is the patient safety, and uh, that's very important in your exam because if you are not a safe doctors, you can't do the exam and pass it. So they really concentrate on this domain uh, in the exam, and the safety issues are like many items in the tick list of the examiner. So you need to be aware what are the safety issues in each station. And there is no specific, thingy to put in your mind, but it differs from a station to another. And while we are going through the stations one by one, I will just tell you and mention what are the safety issues to be fulfilled in this station. Okay, I will just give you some examples of the safety issues related to the patient safety. So, for example, if your patient is taking alcohol, um, we need to ask her to stop alcohol during the treatment if we are going to prescribe metronidazole or methotrexate. You know, there is some interaction between the metronidazole and alcohol, and so if, for example, the patient is having bacterial vaginosis, and she's coming because she's having vaginal discharge, she's not able to cope, and you are giving her metronidazole, you need to tell her if she's taking alcohol to stop it, and this is very important in patient safety. The other thing, if you are prescribing a methotrexate, like for example, if a patient with ectopic pregnancy and she's opted for medical management and you are going to give her methotrexate, you need also to tell her about stopping alcohol for a while, because they will cause together the alcohol and methotrexate together will cause liver toxicity. Okay. So that's a patient safety issue as well. Another safety issue, if we have early pregnancy complications, that means early in pregnancy the patient's getting bleeding, heavy bleeding, or she has surgical treatment of miscarriage or ectopic pregnancy or vesicular mole, and you didn't ask about her blood group. That is important in patient safety because we need to give her anti-D if she's Rh negative. Also, if we are counseling the patient about amniocentesis or chorionic villus sampling, in case she has any problems in her screening test, then we need to explore what is her blood group to offer her anti-D if she is Rh negative. Also, if we are counseling the patient about external cephalic version, we need to give anti-D after that if she's Rh negative. So these conditions, if we didn't ask about the blood group or we didn't mention the word that she may need an anti-D if she's negative, we may lose a big mark in the patient safety issues. Also, one example of the patient safety is to offer folic acid in a higher dose than normal dose in specific cases like obesity, pre-gestational diabetes, epileptic patients, sickle cell disease, thalassemia, any patients with previous tubal neural tube defects or malformation. So all of these people will need folic acid 5 milligrams, possibly 3 months before the planned pregnancy. Or if it is unplanned pregnancy and she didn't start it yet, we have to start her for the first trimester, and this is very important in the patient safety as well. Also, we need to counsel her if she has the same problem for the next pregnancy, she has to plan her pregnancy ahead and she has to start it 3 months before. So this is a patient safety. The most important patient safety item in the history is allergies. we need to ask about allergies, because some patients may have latex allergies, and we just need to examine them with sterile gloves. So if we don't know and we use the latex gloves, that is a very important impact on hair safety. Also, if we are going to prescribe medication, for example, if a patient is GPS positive in your labor ward and you just prescribed penicillin, you don't know that she is allergic to penicillin, you did a very, very big thing in relation to her safety. In the clinic also, you may be exposed to a patient with PID, and you need to prescribe for her antibiotics and you don't know her allergic status. So allergies is very, very important question in the history. Also, in regards of timing of induction of labor, if she requires induction, that's one of the patient safety issues, because if the patient requiring induction at certain gestational age and you left her to wait for spontaneous labor, this will affect her safety and her baby safety as well. So, for example, if the patient is like her age is more than 40, what time we need to induce her? We need to induce her at term. We can't go beyond her due date. So if you got a patient in the exam and her age is 40 years, don't forget to offer her induction of labor at 40 weeks pregnancy, and you tell her that waiting more than that doesn't seem to be safe for you and your baby, you know. Also, if we have the monochorionic monoamniotic twins or monochorionic diamniotic twins, we tend to induce these people earlier, between 35 and 36 weeks. So yeah, if you got a patient like that in the exam, put in your mind that she has a specific time for induction, and this is very important in her safety as well. Safety in contraception, you know, we just need, if a patient came to require like an emergency contraception, for example, we need to exclude the complications and, you know, I mean the contraindications from the history. So there is some emergency contraception we can't give them in asthmatic patient. There are some emergency contraceptions we can't give them in epileptic patient. So you know, we need to ask a full history just to be safe, not to offer a type of contraception which may implicate a problem on the patient, and without knowing that she's having a contraindication for it. Okay. Some patients may need to start antenatal low molecular weight heparin, like according to the VTE risk assessment, but we need to put in our mind that the patient who is having chronic diseases like chronic kidney disease, systemic lupus erythematosus, like a patient with irritable bowel syndromes, like you know, Crohn's and ulcerative colitis, don't forget to offer antenatal low molecular weight heparin. Also, the patient with a high VTE risk score, if she's like, you know, high BMI, high parity, and also strong family history of VTE or previous history of VTE, then we need to offer her low molecular weight heparin. So this is also very important in her safety. So we need to take a full history and see and assess her risk score, and then if needed, we will tell her that she has to start antenatal blood thinning agent and to continue that for 6 weeks after her delivery. So there are lots of patient safety issues. We can't enumerate everything today. We just need to, when we deal with a station, I will just tell you what are the safety points in this station we need to fulfill and not to forget any of them. Okay, so these are just some examples of these safety issues. The fifth domain of part 3 exam is applied clinical knowledge. What is applied clinical knowledge means? That means when you know the guidelines, our guidelines, RCOG guidelines, the green top guidelines, I mean, NICE guidelines, TUG articles, all of our guidelines which we have been already assessed for in part 2 exam, we need to apply it. We need to apply it in our real life, you know. Uh, if you know the information, that doesn't mean that you can apply it on a patient. Um, like, you know, I know that, for example, I know that the management of miscarriage can be expectant, can be medical, can be surgical, but sometimes I may face a patient who have like a miscarriage, but she is not suitable for both expectant and the medical. She's only suitable for surgical because of some problems in her platelets, or for example, she's having some contraindication for the medical treatment, or she is at risk of bleeding. So that's why we need to go only for the last choice or last option. Like also ectopic pregnancy, how to apply the management, like how to apply the options like medical management or surgical management. With it differs from patient to patient. Okay, which patient you may offer a VBAC, which patient you can't offer a VBAC. So that's like, you know, clinical situation and how you apply your knowledge in relation to what you got from the information. Okay, so it's not just the guidelines, it's just how to apply them on your patient. And that also will depend on each station specifically, from the history, the examination finding, and if any relevant investigations done, then we need to formulate the management plan from our knowledge. Okay, so if you didn't listen to the other exam domains, they are in a separate videos. So these are the 5 domains of the exams. We will discuss further, like, you know, station by station, and we will see how to apply all of these domains in the specific stations. Thank you.